The fourth industrial revolution is based on cyber-physical systems and the connectivity of devices. It's currently unclear, though, what the consequences are for patient safety as digital health technologies become ubiquitous with increasing pace and interact in unforeseen ways. In our paper, we describe the output of a workshop focused on identifying the patient safety challenges associated with emerging digital health technologies. We discuss 6 challenges identified in the workshop and present recommendations to address the patient safety concerns posed by them. My name is Kieran McInerney, and I'm a research fellow in the Digital Health and Patient Safety. I'm in the University of Leeds, and I'm part of the Digital Innovation for Patient Safety group in the Patient Safety Translational Research Centre. The centre is based in the Yorkshire and Humber region of the UK, where we are one of 3 patient safety centres funded by the National Institute for Health Research. The paper I'm presenting today comes from some collaborative work with the Patient Safety Centre in Greater Manchester. As I mentioned in the introduction, this paper presents the output from the first workshop in a series designed to develop the field of patient safety informatics and to establish a platform for patient safety informatics theory for future research and development. In this first workshop, we discussed the patient safety challenges of emerging digital health and developed recommendations to address the concerns posed by them. Throughout this presentation, I will use the term digital health as a shorthand for health information technology. Now, when discussing the relationship between digital health and patient safety, we must of course acknowledge previous work by Dean Sittig and colleagues that present an agenda for the safety of digital health. Such an agenda arises from a need for a systemic study of the patient safety consequences of developing, using, and abusing health information technology. Where our paper differs from Sittig et al.'s is that we present the threats to patient safety that are posed by health information technology, while Sittig et al. Presented goals that they have determined to be worthy to facilitate patient safety. Put another way, our paper presents some challenges we face, while Sittig et al.'s paper presents the challenges we should undertake. So what do we do to produce the paper? Firstly, I undertook a review of academic, commercial, and grey literature to collate an initial set of emerging health information technologies. Now, when I use the term emerging, I mean a few things. Firstly, I'm referring to the technologies that on the Gartner hype cycle would be found at the innovation trigger stage or approaching the peak of inflated or exaggerated expectations. For example, there are things like neural implants or interfaces, which are being developed by Neuralink, DARPA, Kernel, and Facebook. But we also included technologies that, although not new, are emerging as an option for use by people or by organizations or in a pathway. For example, drone technology is not new, but it is only beginning to be used for the delivery of medical and pharmaceutical supplies. The initial set of technologies was amended by 14 collaborators who participated in the workshop. Shown here are some example technologies from that list. The 14 collaborators represented a diverse range of expertise in the development and evaluation of digital health technologies. This included clinicians, commercial developers of digital health technologies, software engineers, medical statisticians, and researchers in applied health, health sciences, safety science, human factors, health informatics, and clinical decision making. After reviewing the list of digital health technologies, all 14 collaborators convened an expert interdisciplinary workshop to discuss the challenges associated with the technologies and the consequences for patient safety. Output from the workshop informed a rapid scoping review of the literature that explored the challenges and consequences that were raised, and additionally explored recommendations to mitigate them. I then facilitated the iterative development of a set of challenges, consequences, and recommendations. And I did this by synthesizing contributions from the expert collaborators with subsequent reviews of the literature. So in summary, there are 3 items of interest: how the novel and emerging technologies challenge us technically and socially, the consequences of those challenges for patient safety, and the recommendations for mitigating those consequences. Table 1 in our paper summarizes our recommendations to address the patient safety concerns posed by the challenges of emerging digital health. I'll now briefly explain each of the combinations of challenge, consequence, and recommendation. For challenge 1, we talk about conceptualizing digital threats. It's challenging to conceptualize digital threats to patient safety because they come from digital influences. Much of the innovation in digital health technologies is not physical. Instead, it manifests as software or systems architecture or communication protocols. these lack the tangibility that is so foundational to trust in things like digital and robotic systems. Implementing digital technologies for associated interconnectedness can increase system complexity, and it can reduce transparency, and it also can reduce the traceability of the failures in the system. So patient safety here might be facilitated by the use of dynamic multi-view safety cases for digital health and health care services. Challenge 2 is about trust in increasing complex digital health technologies. Introducing new technologies into healthcare processes can challenge trust between patients, healthcare professionals, and healthcare organizations. Trust is integral to patient care and is partly a function of the interpersonal behaviors between patients, the healthcare professionals, and the digital health developers. Practically, developers and vendors of emerging digital health technologies should include supplier declarations of conformity to industry standards with their products. They could also work to co-develop products and user information with their user communities. Challenge 3 is about integrating and interpreting data sources. Inadequate integration of data sources can lead to misuse, abuse, and non-use of data. Now, on a positive note, increasing the availability of data increases opportunity to support the provision of high quality and safe healthcare, but only if the data are coherent and interpretable. To mitigate incoherence and uninterpretability, the safe development and use of middleware will be essential to provide an intermediary between heterogeneous healthcare data. Other contributing solutions include distributed architectures that integrate electronic health records, dynamic modeling of the data, and methods that respect the latent processes that generate healthcare. For challenge 4, we talk about reactive regulations and standards. Because as the pace of innovation accelerates, the current reactive rather than proactive regulatory and standard-based approaches will be increasingly ineffective at assuring patient safety. The consequence of reactive regulations and standards is that avoidable harm might be experienced before mitigations are put in place. So we recommend synchronizing the development and evaluation of digital health technologies. Now, existing frameworks include the IDEAL framework and the US Food and Drug Administration's software pre-cert pilot program. Such frameworks also address other concerns about the increased administrative burden of these more stringent regulations. And these might delay products that are imperfect but practically useful. So it's important that we integrate the development and evaluation in a gradual, streamlined process. Challenge 5 is about emergent patient safety consequences. When we focus on technologies in isolation, we do not consider the patient safety consequences that emerge when technologies interact. Healthcare systems are complex, with a diversity of organizational forms, interdependence, and feedback effects. Sufficient theoretical and practical guidance is needed to navigate the novelty of emergent consequences and to understand how users anticipate these outcomes and act to influence them. We can help to reveal the factors underlying systems predictability by using systemic conceptualizations of healthcare processes. For example, the NAS framework can help to identify uncertainties and interdependencies of technology-supported change in healthcare. We also want to use a systems-based definition of risk and resilience to complement the systems approach to patient safety. Finally, we have challenge 6, solutionism. Techno-optimism and technology push can drive ineffective and adverse digital health interventions. Solutionism is an ideology that inappropriately recasts complex social situations as neatly defined problems with definitive, computable solutions, if only the right technology was used. Now, examples include things like diet apps that inappropriately simplify body composition as merely a function of calorie consumption just because it's easier to measure. Adopting a socio-technical perspective and a systems approach to conceptualizing risk might mitigate the effects of solution. For example, the Systems Engineering Initiative for Patient Safety model, known as SEIPS, provides a framework for understanding the structures, processes, and outcomes in healthcare systems. This can help to sensitize developers and users to the relationships within healthcare systems that facilitate unintended consequences. And there we have all 6 challenges. The intention of our workshop was to contribute to the process of developing the theoretical and practical foundations of patient safety informatics. Patient safety informatics is at the intersection between the established and broad disciplines of digital technology, safety science, and clinical practice. Key implication of considering the challenges and opportunities for patient safety is the interdisciplinary contribution required to study digital health within its embedded context. And while some recommendations are specific to the challenges, the underlying principles are that of prospective action, systems perspective, and to make sure that it relates to the social, technical, and regulatory aspects. These ideas will be further explored in subsequent workshops in our series that will address the consequences of contemporary safety theory for digital innovation, socio-technical evaluation of digital health, and digital health interventions designed to improve patient safety. So in closing, I'd like to thank again my co-authors, all seen here, and all members of the expert workshop collaborative. Thank you for your time.